Quels sont les traitements actuels de la DMLA? Qu'est-ce que vous pouvez proposer à vos patients, à nos patients, quand ils viennent vous voir?
So the main treatment, we're focusing now on wet AMD. Dry AMD usually does not require treatment, and as I said, just regular follow-ups, year or so at an ophthalmologist. But now wet AMD, there are a lot of treatments, and treatment is very important and very useful. Up until about 10 years ago, treatments relied on laser and something called PDT, which were much less effective than the treatments we have today, and therefore are almost never used. Today, the treatments rely on injecting a very small amount of medication into the eye, into what we call the vitreous cavity, into the eye. That sounds sort of a bit scary, putting a needle into the eye, but it's a very small needle. Usually anesthetic drops is adequate anesthesia, so it's not painful. And this medicine goes into the eye and it filters down to the retina, and there it dries up the fluid that is causing the wet AMD and causing the decreased vision. These intravitreal medications have been a major breakthrough in AMD. So as a group, they work by, as I say, drying up the retina and stopping the exudation and stabilizing leaking vessels that are in the macula. There are three main types. Today, there are three main types, but new medications are expected to also develop. And they're all pretty similar. Although there have been studies showing an advantage over something called aflibercept. That's the most recent one. There has been studies showing slight advantage over the older ones, but the advantages are very slight. Basically, they all work well, and all three are pretty similar. You've got three types. You've got Avastin, which is bevacizumab, Lucentis, which is ranizumab, and Eylea, which is aflibercept. All three, again, have caused a major advance in treatment of AMD, and all three work more or less similarly. The problem that all three have is that when the medicine is injected into the eye, it only remains there for a month or so. So if people have ongoing disease, which many people do, they have to have repeat injections, which can be anywhere between 5, 6, 8, 10, even 20, even more than 20 injections, depending on the case, on a monthly or 2-monthly basis. Oftentimes, we always start off with monthly injections, and then hopefully after 3 months or 6 months or so, we will try to reduce the interval between, or to increase the interval between injections, so to space the injections out. So instead of being monthly, the injections will become 6 weekly or 2 monthly. But generally speaking, the injections have to be repeated.